Now, as before, I mentioned for all patients who get cisplatin or carboplatin frontline, they may be considered for maintenance treatment. So what is maintenance treatment? Well, first off, once patients have gotten their 4 cycles of cisplatin-based chemotherapy, they're going to get a CT to see if the tumor has gotten worse, stayed the same, or gotten better. For patients who have stable disease, meaning disease that stayed the same, or partial response or complete response, meaning the disease has shrunk on the scan, it's recommended to give immunotherapy for up to 2 years. The immunotherapy we use for switch maintenance is a drug called Avelumab. As we discussed before, immunotherapy ramps up the immune system to fight the tumor, and that's what Avelumab does. Avelumab targets something called PD-L1 that's found on the tumor cells. Usually, on cells, PD-L1 tamps down the immune system so we don't get autoimmune disease. But in cancers use PD-L1 to evade the immune cells so the immune cells can't attack the cancer. By Avelumab blocking PD-L1, it disrupts this immune blockade so the immune cells can fight the cancer. Avelumab also interacts with our innate immune system, which is our first line of defense, through natural killer cells. Therefore, Avelumab works with not only the innate immune response, the first line of defense, but also the adaptive immune response, our T cells, our body's second line of defense. The Javelin study showed that patients who got Avelumab maintenance following either cisplatin or carboplatin-based chemotherapy have improved survival compared to best supportive care, which is what we used to do. So typically, before the Javelin study came out, patients would get their initial cisplatin or carboplatin. Then we would get scans to see how the cancer does. And then they would get a second-line treatment, often immunotherapy. But now, instead, patients will get cisplatin or carboplatin. They'll get the scans. And if the scans show response, they'll get maintenance Avelumab for up to 2 years. Avelumab is an IV drug given every 2 weeks.